we're going to start pivoting into talking about kyphoplasty tips and tricks, of which you become well known for sharing these on LinkedIn and X, and always enjoy seeing your cases, which you have a few to share. Let's move into that direction by talking about the kyphoplasty portion of the bone tumor ablation. A little different than run-of-the-mill osteoporotic fracture. You can see all kinds of weird fill patterns and stuff like that. Tell us about things you've learned about this.
Well, one is, if the fill looks like a balloon animal, that's not atypical after you've done an ablation. That's what somebody used to describe it as balloon animals. And I said, oh my gosh, that's what it is. Because it just forms these weird shapes. Don't be alarmed. That's just the way it looks after you do an ablation. If there is a fracture line, you still want to make sure you fill it. And you're going to know that from your pre-procedure imaging. And there's a couple of ways that you can fill it if the cement is not going in that direction the way that you would like it to. First of all, you've got about 10 minutes of working time on your cement, or however long you've got of working time. So don't panic. There'll be plenty of time for that later. So the first thing that I will do is just put a beveled tip trocar in and angle the needle to go the direction that I want the cement to go. As in, if I'm trying to get the cement to the superior end plate and my needle is sitting in the middle of the vertebral body and the cement is just forming a balloon animal there in the middle of the vertebral body, what I'll do is pull it back to the posterior aspect of the vertebral body. So I'm not coming out into the pedicle. I'm still in the vertebral body. I'll use the beveled tip to angle, and then I will crank that thing and try and angle it upward to get that needle to pound into the fracture line. If I can get that needle into the fracture line, then I just put my cement filler in there and fire away. And almost always that winds up fixing the issue.
Very satisfying when you finally get that fracture fill after it's been evading you for a while.
Yes, it's very satisfying. It requires no additional equipment. It just requires that you be thinking about it and notice in a timely fashion that the cement isn't going where you want it to go, and figure out where you want it to go and figure out how to get your needle there. Like I say, just putting a beveled tip in and angling it around tends to fix probably 50, 60% of the problems.
I agree.
For those others that aren't cooperating, there are other tools you can use. This is actually something that you use before you ever get to that point, which is when you're inflating the balloon and you notice that the balloon is only filling the inferior aspect of the vertebral body, and you're trying to get to a fracture line in the superior aspect. Then you have an inkling that, okay, I'm going to put cement in here and it's just going to go where the balloon went and it's not going to get up where I want it to go. So there's a couple of tools you can use in that case. One is you can redirect right then and there before you've even mixed the cement and see if you can get into the superior aspect of the vertebral body with your trocar, and then you've got time. You don't have the pressure of tick-tock. The cement is hardening on you. But anyway, if you notice that, you can try and get in there with your trocar technique right off the bat. If you decide that you'd like to do something else, you can get out the curette, which is kind of a fun little tool. It goes in, and then the tip of it will hook up at 90 degrees, and it's made out of a fairly stiff metal, and you can take that and just twist it around and grind and break up the bone in the area that you want it to go into. It is not uncommon that I will have my reps bring one of those in and do that.
Curette is a really highly underutilized tool. I found it's been very helpful in a handful of cases, and it's something I think there's a lot of people who probably never used one. I think it's a great thing to have in your tool belt.
Yeah, I hadn't used one in probably 2 years. And I had a case once and said, you know what? Do you have a curette? And they went and, blew the dust off the box and brought it in. And I used it and said, ooh, hey, that works really well. And ever since, the reps know to keep one or two in the box just in case we need to use it. The other thing that I will use is Medtronic makes a curved introducer it's called the Kyphon V. It is a straight 10 gauge catheter, and then it's got a curved nitinol introducer that goes through it. So you can use that introducer, you can use that curve without the introducer, and just put it down through a regular cannula. And that enables you to put a curve and send that whichever direction you want to send it to fill the vertebral body with cement. That's another tool that I've used quite a bit. If things are not going the direction that I want them to go, and I'm not able to get the trocar to move it up there the way I need to, often that's the next tool I will reach for, is that curved introducer. And you just tap it down under X-ray, and you can watch it flip up into the fracture line. You pull out the little plastic thing on the inside that, it's got a little plastic thing that fills it. And then you can just attach your cement to that and inject directly through it. After injecting directly through it, you can detach the cement, pull it back, reposition, and pound it forward again. That will usually work. If you're not careful, you can stick some piece of hard bone in the tip of it and it won't work anymore. And then what you have to do is use a metal stylet that they include with it that you cram down there. And that is when you get to make your upper body time at the gym work. And, it shoves all the cement out. So you want to do that under fluoro to make sure that you are putting the cement where you want to put it. But you can clear it with that, I don't know, it's just a metal stick that you push down it and pushes everything out.
It's just some sort of metal stylet.
Yeah.
That goes in there. Yeah.